go.
Hey guys, it's Jemecia Capri, the nurse practitioner extraordinaire. If you're new to my channel, welcome, welcome, welcome. Please like, comment, and subscribe. Here we discuss all things NP, the good, the bad, and the ugly. Let's get it. Hey guys, have you been thinking about which books you're going to take with you to clinical as a family nurse practitioner? I have 3 that I just absolutely loved when I was going through nurse practitioner school, and I'd like to share that with you today. So, also I'm going to share with you at the end a book that they were just hyping up. You have to get this book. It is the best book. It was not. Stay tuned. Hey guys, welcome back to my channel. It's Jemecia Capri, the nurse practitioner extraordinaire. And if you're new to my channel, welcome, welcome, welcome. I am a family nurse practitioner, board certified. I'm also an associate professor online. And I just love empowering students to take control of their clinical, to take control of their degree, and just to give them tips to be successful and motivate them to continue to go. I also like to empower you as just an everyday person trying to take control of your health. So I give you health tips and things to use at home. But today, I'm going to be discussing with you the top 3 books that I used while I was in clinical. And I'm going to just get right in. So the first book that I absolutely loved using while in clinical was the 5-minute clinical consult. Now, some of you have the 5-minute clinical consult on your app or whatever, but I personally like to have it in book form. When you buy the 5-minute clinical consult now, you can get that app, you can download the app as well. But the reason why I like the 5-minute clinical consult is because it's broken down in alphabetical order. So basically what that means is when you open the book, so can you guys see that? It is in alphabetical order, okay? And it will go through, it breaks down the description of the disease. It will give you the basics of the disease, which includes the epidemiology, it includes the risk factors for the disease, general prevention for the disease, and then it goes into the diagnosis. Under diagnosis, it breaks it down as far as what you should be asking for your history, what you should be looking for on your physical exam when you examine the patient. It also goes into differentials, which sometimes you can't think of good differentials while you're in school. This goes into that as well. Then it goes into diagnostic tests that you should be getting to confirm the diagnosis. And then it goes into treatment. Then it talks about the first-line medications, the second-line medications, geriatric considerations. I mean, guys, it breaks it all the way down. It's good. And then it talks about an alert, meaning the things that you should look for, when you should refer, and talks about follow-up care, when you should have this patient back, what you should be doing on the follow-up. It gives you patient education. This book right here, one of my favorites. And as you can see, it says 2019 because I have updated it as well. Also, when you have your diagnosis, it normally will take care of the diagnosis itself on 2 pages. So you don't have to flip. And that's probably why it's so big. You don't have to flip to the next page to get the full gist of it. You open it to that page, that's it, it's open, you find it. The last thing I want to say about the 5-minute clinical consult, it also has ICD-10 codes and it has clinical pearls. So the clinical pearls would be something that, you know, that would give you, like this one, it talks about for anxiety, it talks about psychiatry, cognitive behavioral treatment, starting antidepressants, and benzodiazepines and stuff like that. So that one is really good. Now, Like I said, I love this one, and I'm gonna give you the top 3 of the ones that I love. But then I do have a favorite of these top 3, and I will share that with you. But anyway, so the next one is the Clinical Guidelines in Family Practice by Graham and Uphold. This one, it breaks everything down by topic. It talks about topic, then it goes into the pathophysiology, it goes into the treatment, it goes into the clinical presentation. And so, like for this one, I'm gonna open it up for you so you can see, but let me see, let's get to something here. Metabolic problems, diabetes, dyslipidemia, hyperlipidemia, hypolipidemia. Did I say hypo? That's not right, don't do that, don't say that. Okay, so like say for instance with diabetes. It looks like this on the inside. Like I said, it will go into the topic, right? And then it will go to the clinical presentation and pathophysiology, the treatment, and the diagnosis, okay? And so this one is not as detailed as the 5-minute clinical consult, and it's a lot easier on the eyes for someone like me who sometimes I have a problem with the small print because of my age. Anyway, so, and because I look at the computer all day, all the time. So anyway, so that's this one here. I like this one. Has a lot of good charts that talk about things that you should be aware of as far as diabetic ketoacidosis and all of that good stuff, and hyperosmolar hyperglycemia and the states and what you will see and how you differentiate them between each other. So that's this one. And this one is Clinical Practice Guidelines in Primary Care by Amelie Hellyer. And this one, this should be my favorite one. It's one of my favorites. It should be my favorite because I have a little chapter in here. But that I was involved in as far as, you know, helping out because it's an updated version. But this one, it kind of is a little bit more detailed, like totally goes into like 13 different sections. It goes from page to page to page until she's completely done describing the diagnosis. And this one is really, really good if you're that type of person who has to know why this works this way and why this works that way, and you just want a little bit more meat and you want to just go right into it. So it's like it talks about the description, the etiology, the incident, the risk factors, the assessment findings, the diagnostics that you would have to order, non-pharmacological and pharmacological. And it also goes into the consults, the referrals. Y'all hear that phone? I'm so sorry. I'm sorry. But life happens. Y'all know that happens. Y'all know that happens. So sorry. Anyway, so it goes into the expected course of the diagnosis. It talks about possible complications. Amelie goes deep because her brain is so big. She's just a genius, and she's so down to earth. But anyway, yes, so that's this one, and I'm gonna show you how it looks on the inside. So like say for instance for atopic dermatitis, so it goes like that, it looks like that. The font of it is pretty good. I like the font. I love that she will do like a highlighted section here where she kind of, it's kind of like a grab your eye type thing here for, is that clear? Let's see. Anyway, I don't know if that's clear, but it talks about like commonly seen in patients with other atopic illnesses such as asthma or allergic rhinitis. So she kind of gives you those little tidbits. And even though it doesn't say like clinical pearls, it is a pearl, it's a clinical pearl. And then she talks about the management. If you're one where you have to have different management for a disease process, then this particular book by Amelie is really, really good, because she goes into pharmacological treatments. She goes into first line, second line. She'll go into non-pharmacological treatment, pharmacological treatment. She goes pretty deep. So this one is good, okay? So I just want you to know that I do like this one. Now, I'm gonna tell you the truth. It's not my favorite, but that's just because it's not my favorite. That doesn't mean it won't end up being your favorite. But I wanted to show you these books because if you get these books, you really don't need another book. Unless you need like a lab book that explains the labs to you, but really, the way these books are broken down, it tells you what labs you should be ordering and what you should be looking for. So really, you shouldn't have to, but some people just like to do that. I personally did not. This one here is my favorite of all three of them. Now, I'm gonna tell you, for me, I like a book that I can hold. Now, I know that a lot of you like books on your app, but I'm gonna tell you, when you're a student, and you're constantly reading the screen, there's several reasons why it's best to have a book. Number one, you retain a lot more information when you are reading a book. When you are using your hands, when you're flipping through, when you're visually looking at the paper. That's number one. Number two, when you're on a device, most likely a phone, and you're looking at an app, there's too many distractions. You get phone calls, you get text messages, you get stuff that pops up, someone trying to sell you something. You really should not, I just suggest that you don't do that. Some people are very well doing that. I personally don't suggest you do that, as a tip from me as, you know, a professor. This was my favorite. And like I said, the reason why this is my favorite is because the way that it's broken down. There are 5 main sections of this book. It goes into the topic, the diagnosis. Under the topic, like I said, it goes into what you should be asking, looking for on your health history, your physical exam. I just love this one, y'all. I do. I love it. I love the way it feels. I love the way it's mapped out. It's just easy to read. It's not a lot of just fluff. It's not a lot of fluff. Now, if you stayed till the end, I want you to see this book. Everybody was gassing this book up and was like, you have to have this book. You're gonna use this book. You have to have it. It is the best book. I'm gonna tell you the truth. I am here to tell you the truth. And the truth is, this book right here, I love books. But y'all, this book right here was not, it didn't do it for me. It was not helpful. It was not helpful for me. It just wasn't. Anytime that I thought I could look in this book and get a better understanding, I didn't. I didn't get a better understanding. It was not very helpful, like with what medications you should use. It wasn't, I mean, it did talk about like which labs and you know, little stuff like that, but guys, it just wasn't helpful to me. And I really, you know, some people love it. Some people love it. But when you're in school, you need a book that's gonna give you the facts. It's gonna give you what you need now. You need something that's, okay, this is what you're looking for. On exam, do this. Look for this. Give this medication. Start it at this dose. Get these labs. Have them back in 2 weeks. That's what you need. This right here, I don't know who this is written for, but I don't think it's written for a student. I'm gonna be honest. That's all I can do. That's all I can do is be honest. Anyway, guys, I hope this was helpful. I'm telling you, I wish I had this when I was going through school, somebody telling me, you know, what they tried, what's good, what's not. Anyway, I will have the links to these books down below if you decide you want to get them. Click the link, I have it right there for you. It is an affiliate link, you know, I do have an affiliate program or whatever, but you can get it here, or you can get it wherever, it doesn't matter. But these are the books that I used. I love them. I didn't care for the other one. Some people love it, they love it, love it, love it, but I didn't. And I just want you to know. Thank you so much for watching, you guys, and I'll see you next time. Take care.